Hey everyone, guess who's back? I haven't done a video for ages, and I'm back. Welcome back to the Chinese Medicine Podcast. I'm Maria Hopkinson. I'm a herbalist and an acupuncturist. I'm making a new video today about should I feel worse before I get better taking herbs or acupuncture when I do Chinese medicine. Sorry I haven't made a video for a while. It's just been a busy time in my life and I've got lots going on. But I am committed to you and I really appreciate people's comments and support of the channel. So I've got some super exciting announcements and so stay tuned for those. I'll give you those throughout the video or at the end, somewhere in there. I'm trying to get to 10,000 subscribers this year. I'd love your support in that. So if you watch these videos and you're not a subscriber, click that subscribe button and your whole life will change. In some way, some good way. I'll wish good things for you, every person who clicks subscribe. So what we're going to talk about today is, can the process of doing Chinese medicine make me get worse? Like, should I get worse before I feel better? Now, there's a few, I'm answering a subscriber's question here. Someone actually put this on an Instagram comment on my Instagram Chinese Medicine podcast thing. So there's a couple of answers here, and I want to make sure that I'm not intending to badmouth any practitioners here or anything like that. So the reason if someone has gotten worse before they feel better, it could be part of the process. And the first port of call, if that is happening for you, is to go back to your practitioner and talk to them and ask them, because one is if they have done something adverse and that wasn't the intention. How are they going to learn, right? If you just go away from their practice and you don't tell them, they're never going to know what's happened. And I'm sure that's happened in my practice too. I've had patients in the past that I haven't seen for many, many, many years, and then I've seen them later on. And I'd actually assumed that something bad must have happened because they never came back. And they were like, oh, I was better from that one treatment. And I was like, well, were you? Like, in my mind, I was thinking that's quite unusual. But people don't tell you, right? And I'm sure that there's lots of people that haven't told me that they may have gotten worse, and they haven't told me. I've been practicing for 21 years. I'm sure that that's happened. So don't put it in the comments about all the bad things that's happened to you because you've come to see me. Just call me up and tell me. I don't think that would happen. But what I'm saying is the first protocol should be a conversation with your own practitioner to find out what's going on here. Now, we'll talk about the different reasons why that could happen, but from a general perspective, Chinese medicine doesn't, on the whole, there's lots of different systems of Chinese medicine, but on the whole, most systems don't subscribe to the idea that you have to get worse before they get better. That's not a general thing. I know it is in some other things, like they call it a healing crisis in naturopathy, I think they call it that, where a person does get worse before they get better. In psychology, sometimes people have to face what's going on and they may feel worse before they get better in some systems of psychology. But in Chinese medicine, that generally isn't the case. Now, if you've had... okay, I'll talk about a couple of schools of Chinese medicine thought that do subscribe to that idea, and there's a reason why they do that. Now, in classical Chinese medicine, there's a school of treatment called the Fire Spirit School. Sounds really cool, like Fire Spirit. And they are more inclined to do treatments that could flare people up. Now, if I was a practitioner in that school, you would think that they would be telling their patients that first. And I've certainly given my patients herbs before. I've said to them, you could have a flare-up from this, but I feel like this is the right thing to give you at this time. Now, based on their pulse diagnosis and based on the symptoms that's going on for them, I feel like this is the right, ethically, this is the right thing for me to give them. But I know that formula could still cause them to have a flare-up. And so I've told them that in advance, and I've said, if that happens, call me or tell me and we can rectify this in these different ways. Now, sometimes I've even posted herbs over to people overseas, and they can't just ring me up and get the herbs, the different herbs that they need if they had the flare up straight away. So I might have even posted people 2 formulas and said, if this happens, this would be the treatment, the protocol that you need to go on if that happens. Now, it's not, if you get a flare up, it's not that the herbs were wrong for you even. It's not that they're poisonous to you and, you need the antidote to that poison or anything like that. It's not like that. It's actually that your body wasn't there's ways to prepare people's bodies for that tonification and that warmness. And if there's any residual stuckness or stagnation going on there, we can think of it like that, then sometimes the herbs could cause that sort of a flare-up. And there are some schools of Chinese medicine that don't really care too much about resolving that stuckness first before they go ahead with this tonification. And I think if a practitioner was part of that school of thought, then they would probably tell the patient that, because they would say, hey, you need to stay on these herbs, and like in the long term they'll be better, in the long term they'll feel good, but in the short term they might feel not so good, right? And how they would not feel good is actually based on what's already going on for that person. In some cases where there's like a really acute situation of urgency, like a time sensitive situation, like a person has cancer that they're not able to do any other treatment for the cancer. I've had a few patients like that over the years where they've said, look, I'm not eligible for any treatments, like there's no radiation or chemotherapy or anything like that for me, and they're literally at the point of like grasping at straws, hoping that they could reduce a mass or a lump or a tumour or something like that in their body. Or they might have gone through a whole bunch of treatments and that hasn't worked, or the cancer's gotten worse. And like you're obviously in a time-sensitive situation there. And if a person, you think these herbs are life-saving herbs in that way, in terms of they're not proposing that we can cure cancer or anything like that, but if it can give that person a few more days or a few more weeks, and that patient's willing to endure some flaring up symptoms for that potential benefit, then that's something that the practitioner might talk to them about. So in those cases, yes, you might feel worse before you get better. But in general, no, you shouldn't. Now, why could you feel worse before you get better? Or why could you feel worse from herbs or from acupuncture? So there are some patients that are let's talk about acupuncture for a little second. There are some people that are very sensitive to acupuncture treatments, and they really feel tired and like weak after a treatment if too many needles are used. And by too many needles, I don't mean an excessive amount of needles. I mean for their body, like maybe more than 5 or 6 acupuncture points might be too much for them. And after the treatment, they could feel very sick, like as in just tired, needing to sleep, that kind of stuff. And maybe after a few treatments, they might feel better. But I've even had patients say, I felt really wiped out after that treatment. Now, if a person's already coming down with a cold or a flu and they do an acupuncture treatment, like they might not have symptoms of colds and flus, but they might just be like, if you're very aware of when you get sick with colds and flus, usually one of the first symptoms is people feel cold. They feel cold in their neck or wanting to put clothes on, and they feel tired. And you just feel, you're like, I could just have a sleep. It's 3 o'clock in the afternoon. I could just lie down and have a sleep and get all warm under the rugs. And sometimes if you do that, you will actually not get the flu. You wake up the next day and you'll feel really good. And if a patient's having that kind of situation, they do an acupuncture treatment, then they will often feel very tired because their body needs to rest. It's just making your body do what it needs to do. So I wouldn't say that that's making you worse, but like if a person's like, I thought I would feel energized after this, but I didn't. I felt very, very tired. I've had some patients where they have like what we would call a sleep deficit, right? So they've had so many years of not being able to sleep well, and when they take some formulas of Chinese medicine, it can make them more sleepy, and that's a good thing because they need to sleep. So if their complaint was, I feel tired and I need more energy, and you check their pulse, you give them the herbs, and it's the right formula for them, but then they come back the next week and they're like, you know what, I'm actually more sleepy. I'm even more sleepy, but they are able to sleep and they are getting better sleep than they ever had before. That's a good sign. Their body needs that. You can't just sort of give them this magical ginseng guarana, like, I'm gonna, perk up and it doesn't work like that. So there's some situations where a patient might think it's getting worse, but that's actually a sign of it's a normal progression of how things are going. So there are a couple of reasons. Now, other reasons could be that the treatment was wrong. It was the wrong treatment for you. It might not be the wrong treatment overall, but it could be the wrong treatment at that particular time. So like I said, with that fire spirit school, they don't really adhere to this idea where in other schools of thought in classical Chinese medicine, we think often people need this harmonization first and then they need the tonification. So if you gave them that tonification formula and they had that flare up, that would be getting worse before getting better. The solution there is to, okay, those herbs are still the right thing for you, just put those aside, take this harmonization formula, they take that for a certain period of time, and then the practitioner gives them back those other herbs that they had from before, and they say, okay, try these now, and they can work properly then without the flaring up. So that's, in that case, if that practitioner wasn't intending that flare up to happen, then that could be considered a wrong treatment. Other types of wrong treatment could be like causing a patient to be purged when they shouldn't be having that purging. Well, by purging, it means like expelling something out of a person. Like purging could be causing someone to vomit, causing someone to have diarrhea, or using their like urinating a lot. Particularly their bowels, the purging method is mostly through the bowels, right, mate? And if a person sweats or has loose stools, they're going to lose fluids, and that's needed in some cases because they've got some kind of toxin that they need to get out. But if they didn't need that purging, and there's lots of writings and cautions about these things of mistreatment in Han Dynasty Chinese medicine. So in the Shanghan Law, it's like, and in the Jingwei text that Zhang Chongqing wrote in those Han Dynasty textbooks, a person's been mistreated. This is the way to rectify it. These are formulas for mistreatment. So it's a common thing that can happen. It's been happening since that Han Dynasty. Hopefully, practitioners are able to learn more than they were at that time because we have all of this knowledge to draw from now, and so that's good. But it's sometimes hard for a practitioner to know what's the right course of treatment at the time, and they have to pick a path in which to go down, and they might, in their best knowledge, think that's the right thing to do, and it turns out because there's an adverse thing that's happened. So the person, like this person said to me in the message, is it normal to feel worse before you get better? And so in that case, no, they shouldn't be. If they were needing that purging, they should feel better from it. Although they might have some unusual symptoms that or more diarrhea or more something like, more like a few days of being uncomfortable and then they feel great, versus feeling worse overall. So there could be mistreatment, there could be wrong treatment, there could be a person's very weak and deficient and the practitioner's given them too many acupuncture needles and overstimulated their body. Sometimes the recklessness of that can happen because they didn't check the pulse. So if you check a patient's pulse, then you can generally get a feeling for, like, even if a practitioner is not very good at pulse diagnosis or they're a student practitioner, they can always tell, is this person a very deficient person or is this person got like a robust amount of qi? Let's say we can tell the basic force of the qi. So if a person's pulse is like very weak and deep or hard to find, faint, that kind of thing, versus a person's pulse that's got a lot of blood kind of filling the vessel and there feels like feels a force there. There's an idea that the pulse in general overall reflects your stomach qi, which is part of that central qi of your body. And if there's not that stomach qi in the pulse, then acupuncture shouldn't be done, then moxibustion should be done. And that's a herbal treatment that's kind of warming the points, not sticking a needle into the body and disturbing. The idea is like if a person's very deficient and you kind of disturb the little that they have, it might disturb them too much and make them feel very weak and tired and deficient. And sometimes those people unfortunately have had acupuncture and then they're like, oh, I can't have acupuncture. I just felt so bad after that I would never have it again. That could happen, right? To me, this is one of the reasons why dry needling is kind of not the only reason, but one of the reasons why dry needling is very reckless. They're not trying to necessarily, they're not trying to tap into the person's chi, but inevitably they are, because if a needle goes into their body, especially where these trigger points are, they're going to be stimulating the chi of the channels. They just are. It's like saying an acupuncturist isn't trying to needle the muscles, they're just needling the chi, but they are going to touch the muscle. That's where you're needling into. And it's the same thing, if you needle into the muscle, the chi's there too. You're going to needle into the chi, you're going to disturb that, right? So, and often with dry needling, there can be lots of needles used, and very strong, this twitching sensation that people get, and that in Chinese medicine, acupuncturists might think of that as a chi response. Anyway, so that could be then, and those dry needlers are not checking the pulse, because why would they? They don't care about that. So they wouldn't know if a person's really deficient, or how many needles they should have, and whether they should have it, whether they're not suitable to have acupuncture. And I don't think it's a very popular topic for acupuncturists to discuss, because they don't want to think, they want to think, oh, everyone can have acupuncture, but some people that shouldn't be having it, they should only have moxa or herbs if they're so depleted. That doesn't mean they can't ever have acupuncture, it just means at that time, certainly a lot of needles. So if I had a patient like that and I checked their pulse and I was like, we really shouldn't be doing acupuncture, and they didn't want to do the herbs, and they were like, no, I really want the acupuncture, I just want to try that. I can't imagine that happening, but let's say that did happen, then that'd be the kind of patient where I'd just do 1 or 2 points on them, or try to give them moxibustion if that was possible in that scenario, and explain to them why, and then see how they go the next time. Now, this has happened a few times where I've had some patients where their pulse has been on the more deficient kind of a side, and they really did want to have acupuncture. And so I've kind of gone slowly and seen, okay, by the next treatment. And what happens with those people is they usually get quite a good result just from a few points. They don't need to be like head to toe needle, like the Matrix, every point, no one's a bad needled on them. They can actually get quite a good response from just a few points being used. So I know this is a long video for a little question, but I think it deserves a proper answer, because it's a big question, and hopefully it's not something that would deter you from seeing your practitioner again. So my first advice would be, definitely go and see your own practitioner and tell them what's happened, and see if any practitioner who's worth their salt will want to listen, and have a follow-up with you. If you don't want to go back for a consultation, you can just call them on the phone and say, hey, this happened, I'm just wondering, what's happened here, another thing that can happen with acupuncture sometimes is it can flare up musculoskeletal complaints that were going to do that anyway, and I'm talking really acute back pain problems. So I've had some patients where they've just injured their back, like a facet joint injury. I'm talking someone who can hardly walk, and they're like, oh, I can, they could hardly get out of bed, and they're turning their back, and they can barely put their shoes on, they can't drive their car. Even sometimes I've had house calls like this where I've gone to people's homes and done this sort of stuff. Now, sometimes you do acupuncture and it's almost miraculous, and that, the person can move. And I even had one guy that was jumping up and down in the clinic. He was so happy, and I said, please don't jump up and down. The problem hasn't gone completely away. You can feel it feels loosened up and it's freed up, but it needs time to repair. You can't just kind of miraculously neglect that aspect that needs to happen. Your body still needs time to repair, and that's just what happens. So all acupuncture can do is facilitate the movement of stuff that's going on in your body. It can't put substance in you, and it can clear away blockages and stuff like that, so that then the body's freer to do what it needs to do. But it still needs to do that. It still needs to do that healing process. And so this idea of inflammation causing, especially in the larger muscles of your back or in the fascia at your lower back, where it all just kind of spasms up and the person's like very stiff and can't move, there's a process there where the person is there. I don't want to say they're going to be getting worse anyway, but sometimes like you've seen them on day 1, and by day 3 that might have been the worst of the situation anyway, and so you can lessen it, but it's going to come back again. And and there also are things where, like, we have an idea of local treatment versus distal treatment. Local treatment is treatment that's like really close to the area, and then there's treatment that's distally farther away from the area. And so there's different ways of approaching it. Sometimes when something's really acutely happened, we don't tend to needle the local area, because that can flare it up more. It's like, okay, this is already aggravated, and then putting more needles in there is just going to aggravate it more. So there's one school of thinking that says, well, let's not do that. Let's only use points on the hands and feet that kind of are going to affect that area. And the person will know, because that's the Dr. Tan balance method, or just the idea of balance acupuncture or distal acupuncture follows that methodology, right? And that's a very effective method to treat things like that. And I've had some patients over the years that's what I've chosen to do, and they haven't had that before, and then they've been concerned that, well, why don't you treat my back? And I'm like, well, I didn't want to flare your back up, make it worse. Like this is the thing I've chosen to do in the best of my understanding at the time. But it might not be what the person's like used to having or have had before. So it can be a very multifaceted response. So it's not just like a one answer for this. And so I don't want to badmouth any practitioners or say, because you've got worse, that's not what Chinese medicine's about. That must be, they must have been doing it wrong. Like, that's not what I'm saying. So please go back and talk to your practitioner. That's why they call it a practice of medicine. Practice is the learning to do it. Like you study it for your 5 years or your 6 years or your 4 years or whatever long you took to study Chinese medicine. And then your practice really begins, right? You set up your practice. And how you learn to be a good practitioner is through patients coming in and out and seeing the results that's happening from you doing the medicine. And so you're a vital part of that as a patient. Like, it's good for you to tell your practitioner what's happened, so that they can learn from that, and they can also hopefully help you to a better place. And also, if that was an expected result to happen and they just didn't tell you for some reason, maybe they forgot to tell you, maybe they didn't realise to tell you, or they got busy or something has happened, and you just need to take the herbs or whatever for a few more days, and then you'll get through that period of not feeling great, and then you'll feel fantastic. Like, you don't want to miss out on that and then just sort of like stop taking the herbs and, miss out, do that. You find, that you could have had the result you were looking for if you had have just kept on taking them. Likewise, I always tell patients, if they're not sure about something, this is what I tell my patients, please call me, because sometimes I've had patients endure symptoms that they may not have had to necessarily endure. And they come back in 2 weeks and they were like, oh, I had like diarrhea for like a whole week from, those herbs. And I was unsure that, that was was that what was supposed to happen? But they were like, I must have needed it. And they ended up feeling better, but possibly the dose of the herbs might have needed to be less in that scenario that I can think of. But the patients thought that it was necessary for them to endure that. And I have told them, if something's happening that you're not sure about, just call me. And, so sometimes it's a matter of dosage. It's not that the formula is wrong. It's just that might be too big of a dose for that person. Sometimes I've had to increase the dose to the patients. Like, they're like, oh, I'm getting better, but not quite better. And the pain's still there. If it's a pain situation, maybe the herbs could increase in the dose. And so that's not something that you do as a patient by yourself. You want to make sure that's in consultation with your practitioner. Never change the dose of something by yourself, because you don't know, like, if your body can tolerate that higher dose, or if you reduce the dose, you might not be getting any effectiveness from the medicine at all. So yeah, I hope this video has been useful and helpful to you. I am running some courses in Chinese medicine, so you can click the link below to find out more about that. I'm in the process of making the courses that I've run live as on-demand courses. So you can sign up, and then you get access to a web page, and there's a video there with me talking. Some have PowerPoints, some have handouts. So any learning materials that I create as part of the course, sometimes I have little excerpts of books or things like that I've included as part of the handouts. That's all in there. Some of the courses are just video tutorials. Most are between 2 and 3 hours in length of talking time, but whatever it is will all be on the sign up page, so you know what you're getting. And I've got courses on emotional health. I've got something on, I'm working on putting up one soon that's going to be a course in how to understand your 5-element personality types and getting interested in that kind of thing. And then we've got courses on kids' health, foods for babies and kids, weaning processes for that. I've just finished the course on that, so I've got to put that up. And there's lots of courses that are there. 5 elements, foundational concepts of Chinese medicine. So there's a 12-week course option for some things. There's a one day course or a 3-hour course. Some are a 5-session course. There's lots of different ones. So really appreciate your support. Make sure you click subscribe. It really helps me. I want to get to 10,000 subscribers this year. It's a big ask. I'm going to be pumping out more videos for you. And thank you so much for your attention. I'll see you again on another video soon. Have fun learning Chinese medicine. And I'm back to make a video today about so excited about being back. Guess who's back? Back again. That crow